Yes.
Welcome to this practitioners discussion session on the world's best safety media campaigns, where we're discussing safety promotion and awareness campaigns from around the world as acknowledged through the International Safety Media Awards program. My name's Barbara Manuzzo, and I'm the coordinator for the International Safety Media Awards program, which is run by the Center for Safe Alaskans. I would also like to acknowledge the support of Safe Compac in providing technical assistance for today's discussion. Joining me today is Professor Koustuv Dalal. Professor Koustuv Dalal is a senior health economist and prevention scientist. Welcome, Professor Koustuv, and thank you very much for making time to speak with us. Professor Koustuv, to start with, can you please tell us a little bit more about you and then about your connection to the International Safety Media Awards program?
Thank you, Barbara, for making this opportunity. Yes, I'm by training, I'm a health economist, but my research is mainly focused on injury prevention and safety promotion. And also I do a lot of participatory research at the community level and implementation science. So where I implement the programs and afterwards I evaluate, and economic evaluation is one of my expertise, also along with the health systems research. So that gave me a big opportunity to work for the last 2 decades or more than 2 decades for injury prevention and safety promotion. And actually I should also inform here that I I know Marcia and this Safety Media Award since the beginning. I think so, and it's glad that now I'm working as a jury of this Safety Media Award, and I'm very happy for this year's submission. They're really good, and I can also acknowledge that it's a good progression. I think it's a good significant signaling for the safety media and injury prevention field, that how we are getting, the quality is getting improved years after years, and they are now more focused and containing mainly directly focusing on injury prevention. So that one of the major achievement I should inform to you.
Yes, 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 thank you for that. We know that measuring injury burden globally is complex due to the differences in measuring cause of injury versus nature of injury and the temporal difference between them. You've spent many years working in this safety community, safety promotion, injury prevention space. Can we turn specifically to your work and research um, into the cost of injury and the injury burden? Can you tell us about the cost of injury and also translating research into practice?
Yes, Barbara. I should mention a couple of years back, it's me and Professor Leif Baustrom. We had published one article on the cost of injury. And if I remember correctly, it was, I think, 2015 or 16. So at that time, the world was losing a big amount of money just due to injuries. And if I remember correctly, for example, USA has the highest burden of injuries. It was losing almost 2% of its GDP. And that's
Mm,
not a matter of jokes for USA. And for example, in Indonesia, it was almost 6%. And most importantly, I had also argued there, and in many conferences, I had also argued that, for example, in Iraq, Iraq was losing almost 22% of its GDP for injuries. And how much fund, foreign aid it was receiving from World Bank or international agencies, it's almost 4 or 5% of its GDP. So that means whatever money the foreign countries and foreign aid agencies or international agencies are pouring in, it's a much bigger hole in the system, in the economy. So at least it's like a black hole. The injury is accepting or engulfing 22% of the GDP. And from foreign, we are inputting 5 to 6%. Still, it has 14% gap. So we know that injury is preventable. You cannot say that disease is preventable. You cannot guarantee. Every second or third or fifth year, we are getting a new virus. So you cannot guarantee that communicable diseases are preventable. Yes, it takes time. And even after decades of UN establishment, we could not eradicate all communicable diseases from the world. We had so many non-communicable diseases or lifestyle diseases, and the burden is increasing. But for injury, it's the most neglected field for the public health researchers, for the policymakers, for the media. And here I should recognize that this initiated by Marcia and this SAFE Alaskan uh, organization, this Safety Media Award is playing a big role because it's uh, most of the time in the low and middle income countries, because low and middle income countries are actually losing almost 75 to 80% of total world burden of injuries. And they are already struggling their money and they're losing this huge money. For example, India was losing around 5 to 6%. Indonesia is losing 6 to 7%. Russia around 4 to 5%. And if you go to Bangladesh, it's around 4 to 5%. If you go to African countries, it's around, if I remember correctly, it's around 7 to 10%. So those countries are already struggling for their resources. And just for injuries, which are preventable, they're losing the big money. And it's neglected. It's neglected by the researchers, by the policymakers, and by the media. For example, now the media is covering so much in Corona, but till today, more people has been died by road traffic injuries than Corona. How many media has come out to cover it? So every year we are losing more people in this world than Corona. But now all media, all policymakers, everyone is thinking and discussing about Corona. I am not saying that this should be underestimated. No, my point is why media is not putting the same emphasis like Corona on road traffic injuries, on fall, on burning, on burn injuries, on violence, on suicide. Why we are not putting the emphasis? But now, the last couple of years with the Safety Media Award, actually few dedicated persons are creating the media focusing exclusively on injuries, and it's gaining the momentum. So I should say that even we are losing that money, but policymakers are guided by the media and the money. So from our side, from health economic side and from research side, we are providing the monetary cost. And from the media side, the Safety Media Award is boosting up for the media campaign against injury prevention. And that's a win-win situation.
Mm.
I think I can explain it. Thank you, Barbara.
Yes. Professor Koustuv, one of the things that's really mind blowing when we really um, tune into this issue of cost of injury, burden of injury, is the saving, the money saving, the economics aspect of that. Um, with injuries. Can you tell us a little bit more about that? I mean, I've actually sat in the audience of you speaking about the economics of it all, and it's really very inspiring and mind blowing for me to hear.
Yes, I actually mentioned that how much we are losing from our GDP, and we are struggling to maintain our GDPs. So there should not be a bad growth rate. So we had the way out from the SEP communities and safety interventions. We had estimated in Sweden that if we have the safety planned or evidence-based safety intervention in the SEP communities, we had estimated that the cost benefit will be approximately 1:10. That means if you had cost 1, at the end of the day, the benefit will be 10. And I think that should be a clear indication for the policymakers that how the injury prevention and safety promotion activities can save the money. And actually, alternatively, they can, I should not use the word earn, but they should get the benefit of up to 9, because if invest 1 and benefit is 10, so it's almost 9. So they can gain. Also, one thing I should say that we had also statistics from the SAFE communities that it reduces the injuries up to 30 to 40%, and especially the hospital bed days up to 70%. So all the hospitals are struggling with the regular patients, and if the injury patients come, those are simply extra patients. So if with these injury prevention activities, we can reduce the injury patients bed days up to 70%. That should be a great benefit for the health systems. And I think these two information should be incorporated in the media. So the policymakers should get the information and they should be more loyal to injury prevention activities.
Mm. Yes, yes, and that's something to really keep in mind in terms of the importance of investing in injury prevention. Not only are we saving the lives, but yes, it's just so good, obviously, for the communities, the society, etc. Thank you so much, Professor Koustuv. Yes, I know that you're passionate about evaluating programs. Would you like to
Mhm.
talk about the role of evaluation in safety media campaigns? So, how do you know that what you've done has made a difference? Please describe some evaluations, methodologies, and outcomes.
Before that, I should give 2 or 3 examples of safety media. One fantastic example from Iran, another from Thailand. And there were, I forget if they actually submitted, there were also some good media coverage in Taiwan. So those uh, revolutionary, I must use the word revolutionary media campaign against injury and violence, especially injuries. So those have immense impact on public life. You know, the problem of the media, especially in the big cities, when they campaign, they are by the mostly by the government asked, or the NGOs asked, or the private organization asked, the advertisement agencies. So the ad gurus are creating so more attractive, because they believe in TRP, because they generally make the advertisement or all those campaigns for TV, for uh, the normal life. They had no idea about injuries, with due respect. So when those people are making or creating the advertisement for, or creating media campaign against injury prevention, those could be very attractive but not informative. A simple information can give some um, revolution. For example, if you say that every day, if I can say like every day in the media, if you open the newspaper, you will find, okay, today there was a bus crash or a car crash, and certain X or Y person has been died. So we are habituated to see these sorts of news every day.
Yes.
And we are not habituated to react because it's a normalization of road crashes. But few examples like in Iran, they actually knock the public mind. So they knock the people, so they change their behavior. Actually, one of the basic role of media is to manipulate, to inform, informative manipulation. And when we are discussing about injuries, the media, before the safety media campaign, in general, media has failed for this informative manipulation for behavioral modification against injuries. And with due respect, most of the policymakers and the common people has no idea about injury mechanism. Injury mechanism is very simple. So who are making the report, they are making the report for number of deaths or number of hospitalizations. And that is why it became a normalization of the media reporting. But when the Safety Media Award has been started, we have seen for the last few years that how a small effort from a small group or even some individual has immense impact on the public. It could have a small target group, but even within the small target group, the impact was immense. And I think that that is one of the most success story of the Safety Media Award.
Yes, yes. Um, so you're familiar with many safety programs and campaigns around the world, and you
Mhm,
mentioned a couple of the countries just then. But
mhm.
what have you seen work well for safety media campaigns that aim to reduce intentional and unintentional injuries? What have you seen that works well for them, for the media campaigns?
I always say in this way that we, the people, think everything in our own perspective. So when we, even for the safety media, sorry, when we make some campaign for child injury prevention, we, the adult, don't think that even the environment we make for the children are not for the child friendly environment. That's the adult environment. We actually forced the children to be adapted in that adult environment for them.
Yes.
But the problem is, as we adults think for ourselves, we never think for the elderly, for the children, for the vulnerable groups. We believe, especially the engineers believe, that everyone should adapt that environment.
Mm.
And in the OECD countries, we have hundreds of studies that how built environment is creating uh, vulnerability for more injuries. In the low and middle income countries, how the road design is creating vulnerabilities for more injuries.
Yeah.
And when the safety media campaign has been started, if we see from the very first day and the entries, we can see that how those small efforts has actually targeted that they should not adapt, rather the design should be changed. The
Mm.
road design should be changed. The information should goes in their language, not advertisement language. So the language, uh, the safety media entries, safety media award entries has been used is actually their language. So that's the best thing. If you ask me what I have evaluated, that's the best thing I have evaluated. That
Mm.
when the so-called commercialized or commercial injury prevention advertisement are using the scientific jargons or the very commercial terms, which is not attractive or penetrating the common people's behavior. But the safety media award entries has used such language that common man should understand in their own self or
mm,
themselves. So when you understand in your own language, it's much easier. If I speak your language, then it's easier. I can convince you, I can manipulate you, I can have this uh, informative manipulation. But if I use, for example, now if I say that's the odds ratio, that's the confidence interval, it's not easy for a non-scientific person to understand. Even who are not from the public health field or from the epidemiology or medical field, it's very difficult for them to understand those scientific terms. But
mm,
if you use that, okay, for road traffic injury, this country has lost that much amount. Or for example, this year we had some fantastic entries. They used exactly the common man's word. And
yeah,
when you convey the common man's word, your message to the common man, it's easier for them to communicate. Even
yeah,
media most of the time plays a one-way traffic or one-way communication pathway. To me, I think that the entries in the Safety Media Award this year has exactly, even it's one-way pathway, but they had the potentiality to penetrate the common man's mind, and I think they have e- enormous informative, manipulative capacity for the common
mm.
people.
Lovely, lovely. Thank you for that. Yes. So, Professor Koustuv, can you also please talk more about how using media to promote safety works differently in different countries? Again, given that you've gained a lot of expertise working around the world with different countries.
Yes, I must say that I told a bit in the previous session, but previous question, but I must say that um, even in the low income countries, I have seen that some schools have already started some safety campaign using the children. I can give you one example from Bangladesh. It's one of the least developed countries. And they had started even it's a least developed countries, they had started the safe community program there. And I was there for evaluating. And they are using the media, not the national media, but the local media to manipulate or to inform the school children. For example, there they use the uh, positive graffiti. It's not on the wall, but at the entry of the small premises where the kids play. So every now and then they changes the word. They changes actually the board. And the
Mm,
board, it's in their local language, but uh, most of the children had the cut injury, and at home they had the cut injury because they put the knife and uh, the mother or the parents or the relatives, they cut the vegetables and put the knife in such a way when the child is running, so it cut the lower part of the body. So they told many times to the adults, and adults are adults because it's very difficult to change the adult behavior. So what they have done, the local people, they use the children. So they in the local language they wrote that you can cut the vegetable, but if you place the knife in such a place that it should not hurt me. So then they use the mother-child relationship in that campaign.
mm,
So for any mother, the child is the most precious one. So when the child is dancing and singing, that you cut the vegetable but put the knife in such a way that it should not hurt me. You put the knife an upper place or somewhere I could not get reach. And with this campaign, and the kids are using the rhymes. So
mm.
they're reading it and they're dancing. They're uttering the rhymes. And
Yeah.
kids are, when they finish their playing, when they're coming back to home, they're dancing and uttering the same rhymes. So
Yes.
the 1 kilometer or 500 meters pathway, everyone is listening that rhymes. And
Yes.
every adult is very fond of listening rhymes from the children because it's their fantastic voice, God gifted voice. Every child has that
Yes.
voice. So when the small child is uttering in their that lovable voice the rhymes, so it's knocking every adult in the pathway.
Uh-huh.
And when the child is entering the dancing, because now she is or he is approaching very close to the mother, and
Yes.
naturally the mother is asking, what are you singing now, what are you uttering now? Oh, I did this, I learned this today. And
Yes.
you should not place that knife here, rather you should place that knife here. It
Yes.
knocked thousand, I should say it's $1 billion campaign. Actually, they did not spend, they spent maximum $1. But to me,
Yes.
it's $1 billion campaign.
Yes.
So these sorts of local campaign
Yes.
involving the community is very effective. And I should say it's much more effective than all those huge $1 billion international campaigns.
Yes. Yes. That's lovely. That's a lovely example.
Mm.
So what about the production quality and creative changes over the years? So in terms of visuals and video graphics and the creatives that you've seen over the years, it sounds like you've touched and covered some of that by saying that you've already noticed an evolvement in your time as professor um, in the safety promotion and prevention. But is there anything more that you wanted to add to that?
Yes, I should say again that when the campaign should start, they should involve the specialist. The policymaker, it's not possible for one policymaker to know every field. But unfortunately, in this world, the same policymaker is deciding every campaign from that ministry or from that government or from that authority. And it's a common sense that one person cannot be jack of all trade. I'm not repeating I am not saying the last part, but one person cannot be jack of all trade. So when one policymaker is deciding each and every campaign, so the same policymaker is deciding for low and middle income countries because those are the most affected by the injuries. Low and middle income countries, the same policymaker is deciding the campaign for dengue, the same policymaker deciding for corona, same policymaker is deciding for road traffic injuries, same policymaker deciding for the drowning. And the mechanisms are different. And the advertisement agency who is creating it, they have no idea. They just want to use the wordings.
Yes.
So the policymaker is asking and they are using the wordings. And that is why most of the big campaign by the government or the big private agencies are failure, gross failure. Unless they know the mechanism and they know the language what the other side is understanding, the campaign is failure. And
Mm,
that's why nowadays the social media has come in and playing a bigger role than the so-called general media.
mm,
Because in social media we are using each other's language, we are communicating each other, we are understanding each other more effectively than understanding some very tough wordings from a very so-called very reputed newspaper or reputed journal, because that reputed journal or the newspaper could be for a specific group of audience or readers. But in the social media, it's we are using each other's language, so it's for everyone. And that's why social media is playing better role and taking bigger chunk of the media industry. But for the safety media award, I should say that the wording they have used, even it's in the newspaper, even it's in the campaign form, but the wordings they have been using, or especially this year they have used It's fantastic.
Mm.
So I should say that uh, the world is changing. Even it's very slow, maybe snail mail, but it's changing. So that's a very good sign. But it's not with the expected pace, but maybe we can expect that after the corona crisis over, we
Mm.
can have better space and better pace both for safety media, and let hope for the best.
Yes, yes. So, to finish off with, would you like to share some key tips for practitioners that are undertaking safety media campaigns? Some key tips for the practitioners that are undertaking safety media campaigns, as you know, to finalize our interview.
Yes, I should reiterate that World Health Organization has been asking for evidence-based approach. So for the here I also utter or reiterate the same evidence-based. So something definitely innovation has a bigger role to me than evidence-based. But innovation takes time and needs better understanding than evidence-based. So for the low and middle income countries, I must say that they should rely both evidence-based and innovation. Because
Mm.
I gave one example from Bangladesh. I can give hundreds of such examples, how the local media or the local community, or not local community, how the community using the local language or local sentiment, the community sentiment, has manipulated the small media, or very they do not have huge money, so they used a small amount of money but have $1 billion impact. On the other
Mm.
hand, if we use the evidence, because some I have also experienced that some communities or some big programs was also started with some great mistakes, and after realizing after 1 year or 15 months, they realize it's a mistake. I'm not saying the name of the country or name of the place. I know in one place, they have noticed in the evidence-based approach from WHO, they have noticed that on the road, if you use some demarcation for the cyclist, for the motorcyclist, and for the car occupants. So if you actually, if you separate between the two-wheelers and four-wheelers, a pedestrian has their footpath or pavements. But if you, on the same road, if you separate two-wheelers and four-wheelers or more, then if you reduce the exposure, then the impact of injury is much lower. And actually the incidence of injuries are also very low. So they have seen that they have separated. So what that country, or specifically that area, has done, they put uh, lead oxide on road to indicate that this red zone is for the two wheelers. And on red oxide, if it's rain, that means if it's water, it's terrific slippery. So what was
Mm.
happening? But the two wheelers rider or the driver, they had no idea that it should slip. So the
Yes.
first day, what happened, when it was raining and they tried to brake, they did not stop. Rather, they went couple of meters ahead, and in the mid of the crossing, they braked. So initially, they could not understand what happened, and then in the next few days, a couple of fall actually from the bike, or from the two wheelers. So they could not understand what was happening. So the policymakers came, because it was a big chaos in not that actually, couple of crossings. It's a big chaos in those areas. So after a couple of months, the policymakers came in and they could not understand what's happening, because it was in the it's evidence based that it should be separated. So what is happening? And fortunately, we were there, and we immediately discovered, because this is the red oxide. So it should not be red oxide. It's a specific color they should use there, not red oxide. So just this simple mistake has caused so many injuries. Fortunately, no death, but so many injuries. So even we are using the evidence-based, but unless the policymakers understand the mechanism, it could be boomerang. You are from Australia, so you know boomerang better than me. So unless we know the mechanism and the cause, I should request the policymakers to consult the injury prevention scientist. That's the biggest challenge. But there are the number of injury prevention scientists are growing in the geometric progression. So every country will find some good expert, or they can contact any international expert. So if in the media campaign the policymakers involve the injury preventionist, I think the campaign will be again the $1 million campaign. It's much more cost effective. Thank you.
Thank you. Yes, that was a great example because yes, when we're trying to be really innovative and even when we're trying to use, the evidence-based model, etc., yeah, we have to also make sure that we're not creating new hazards with
Exactly.
whatever we're implementing because we might not have a true understanding of what we're actually implementing. That's a very good example of that. Thank you. So thank you so very much, Professor Koustuv, for being with us today. It's been great to hear more from you, and thank you for being one of our great judges for this year's awards. We're really excited that we're now coming to starting to almost showcasing some of that work soon. So before we finish off, just as a reminder that due to the coronavirus epidemic, the Safety 2020 conference has been postponed until November 2022, with a virtual global event taking place in the meantime on the 22nd to the 26th of March 2021. The winners of the 2020 International Safety Media Awards will be announced at this March 2021 global event, so stay tuned for information around this time. Thanks again for joining us for the discussion about some of the world's best safety media as recognised by the International Safety Media Awards program. And thank you also to the Centre for Safe Alaskans for founding and sponsoring the International Safety Media Awards since 2006. To all our global safety colleagues, as always, we wish you success in improving safety outcomes for your community. Thank you.
Thank you.